Hello everyone, let us start with our today's topic, that is gingivitis. Any itis, it is a inflammation. So the meaning of gingivitis is the inflammation of the gingiva. Here we have to study the different types of gingivitis, classification of a gingivitis based on the duration. Based on the duration, it is classified into acute gingivitis, chronic gingivitis. What is acute gingivitis? Acute gingivitis having a sudden onset for a short duration. It is due to the trauma or foreign body impaction, foreign body impaction. There is a presence of pain, redness, swelling is also present in the acute form of gingivitis. Gingiva returns to the normal state when we cure the etiology of that gingivitis. It is curable one when we work on the etiology. Then what is the chronic? Chronic is the for a longer duration. Onset is slow onset. Pain is absent. There is a presence of a gingival changes in two states, active state as well as a dormant state. Active state and dormant state. In the active state, there is a swelling, redness, bleeding, as well as a halitosis present. Halitosis is the bad breath. In the dormant state, there is a firm fibrotic feathery type of appearance. Feathery. There is a third type of gingivitis, that is a recurrent. Means recurrent gingivitis means if we eliminate the etiological factor, then gingivitis then also it is present, so there is called as a recurrent gingivitis. On the second, on the basis of location and extent, there is a another classification of a gingivitis extent. First is the localized, second is the generalized, then marginal, fourth one is the papillary, and fifth one is the diffused. So listen it very carefully. What is localized gingivitis? When there is a less than 30% of the teeth are involved, less than 30% of teeth is involved, then it is called as a localized one. What is generalized? When there is a 30%, more than 30% teeth are involved, is called as a generalized. What is a marginal gingivitis? Papillary and diffuse one. Here, this is the two central incisor, upper central incisor. The space here is the interdental papilla space. interdental papilla space. Here is the marginal gingiva present. So, above the marginal gingiva, there is a presence of attached gingiva. Then there is a mucogingival junction here. Here is the mucogingival junction, and above that there is a alveolar gingiva. So, when the gingivitis, inflammation of a gingiva present in the marginal region, it is called as a marginal gingivitis. When there is involvement of a interdental papilla, gingivitis involving the interdental papilla, it is called as a papillary gingivitis. And what is a diffuse? Let us look here. There is many MCQ ask about the diffuse gingivitis term. So what is diffuse gingivitis? In this type of gingivitis, there is a involvement of a marginal gingiva plus involvement of a interdental papilla, and some part of attached gingiva also involved. So if examiner ask about the diffuse gingivitis, so we have to tell that ki diffuse gingivitis is the type of gingivitis in the marginal gingiva, interdental papilla gingiva, and some part of the attached gingiva is involved. So it is called as a diffuse gingivitis. In dental pulse, there is a one MCQ present, in that the options are given, and there is a mention answered uh, is wrong. So look this MCQ very carefully and solve as per this concept. So our next concept is the stages of gingivitis. Stages of gingivitis. There is a three stages basically. Initial stage, early lesion, as well as established one. Initial stage occur in the 2 to 4 days, early occur in the 4 to 7 days, and established occur in the 14 to 21 days. In this initial stage, there is a vasodilatation occur. Here is the vascular proliferation occur, and in established stage, the vascular proliferation plus the blood stasis occurs. Um, in initial stage, there is a polymorphoneutrophils are predominantly seen. In the early stage, lymphocytes are seen, and in established stage, there is a plasma cells are predominant. So, the first stage is the initial, then early, and then established. In initial stage, predominantly polymorphoneutrophils are present. In early stage, lymphocytes are present, and plasma cells are predominant in the established stage. In initial stage, there is a perivascular loss of collagen is seen, and there is a increase in the GCF rate. GCF rate is increases. In the early stage, there is a retipic formation in the atrophic area. Retipecs are formed in the atrophic area, as well as there is a increased loss of collagen. Loss of collagen is seen. Here also collagen loss is seen. In all three stages, collagen loss is seen, and it gets increased in every stage. In first stage, there is a increased GCF rate. In second stage, there is a BOP positive, that is bleeding on probing is positive. And in third established lesion, there is a changes in color, size and texture are occur. Changes in color, size and texture occur. So the theory behind stage development is that it is a experiment behind the grading gingivitis, which is given by Louis et al. Here one MCQ is there. So we have to start with the MCQs now. If they ask about the first visible sign of gingivitis, first visible sign of gingivitis, what should be our answer is? Our answer is the bleeding on probing. Then, what is the clinical sign of gingivitis? Appear in the early lesion. What is clinical sign? GCF rate increases. In early lesion there is a BOP positive. Then, what is a GCF? GCF is a inflammatory exudate. Some things about the plasma cells. These plasma cells are responsible for the production of the antibodies, most prominently the IgG antibody. So, this is another MCQ. So, let us discuss with some etiopathogenesis. Bacteria come, releases toxins, then phagocytosis occur with the help of the bacteria. Then there is a reactive oxygen species are released, reactive O2 species are released, and which causes the inflammation and thereby the GCF fluid increasing. In the pathogenesis of this, there is a some stages are given. There is a leakage of inflammatory transudate when the blood vessels break, is known as a GCF. Here MCQ is asked that in later stages of periodontitis, predominant cells in the cellular epithelium is, this is the neutrophil, polymorphoneutrophils are the predominantly present, and then in connective tissue there is a plasma cells are present. Gingivitis progression is done in after the third stage of the gingivitis. In the advanced gingival lesion, there is a connective tissue destruction of a connective tissue. Then there is a bone loss and the pocket formation also done. When there is a polymorphoneutrophils are present more in amount, the pocket formation is done. When if the more than the 60% cellular or oral epithelium are filled with the polymorphoneutrophils, then the junctional epithelium loses its cohesiveness and migrate apically migrate and leads to the pocket formation and further leads to the periodontitis case. So here is our tooth. This is the gingival sulcus alveolar bone. This is the normal tooth anatomy. Here is the epithelium present, bacteria attacking, then causing the increase in the neutrophil production. So this junctional epithelium are shifted apically, shifted apically, and then it leads to the formation of this pocket, leads to the pocket formation, and further bone losses occur and leads to the periodontitis case. So here is we are done with the topic of a gingivitis. Stay tuned. Happy studying.